In a cataract surgery, we replace the cloudy lens with an artificial one. Since this is a hard cataract, our doctor uses the dyeing technique. Then, he opens the cornea with a tiny incision and inserts a needle-thin probe where the cataract has formed. This probe transmits ultrasound waves that break up the cataract, and the fragments are removed by suction. After cleaning the last fragments, he begins to implant the new lens. The surgery ends by injecting protective antibiotics.